Welcome to the EM Supply Room series, where we teach you everything you need to know to be in and out the supply room for your procedure in 5 minutes or less. An NYU EM APP fellowship production. First, get familiar with important structures and landmarks within the femoral triangle. This is what your view will look like on the ultrasound. Recognize the femoral nerve and the fascial planes. These are the materials that you will need, which includes blunt needle and syringe, a 23 gauge needle, a nerve block needle or another needle to administer the block, extension tubing, a large 20 cc syringe, a chloroprep, and fastening materials like a tegaderm and tape. Identify the general region that you'll be working within. Identify the landmarks. Imagine a line from the anterior superior iliac spine to the pubic symphysis. Prep the area with chlorhexidine and grab the probe cover as well as sterile gloves. Inject a wheel of anesthesia in the skin where you'll be inserting the block. Insert the needle block needle tip through the fascial layers from lateral to medial, going parallel to the inguinal ligament. And pay close attention to where the needle tip is located on the ultrasound itself. Once the needle tip is inserted deep to the fascia iliaca, hydrodissect to see the fascia iliaca lift off the nerve bundle. Then switch to lidocaine, either with another syringe or with the stopcock. Inject 8 to 20 cc's of anesthetic. Here you can see the fascia iliaca lifting off the nerve bundle.